A young man walks into a blood donation center on a quiet Saturday morning. He's excited. Today is the first time he will donate blood. He feels proud, healthy, strong. He exercises almost every day. He goes to work. He spends weekends with friends. He hasn't been admitted to a hospital in years. He doesn't have a fever. His eyes aren't yellow. He doesn't feel tired. In fact, he feels completely normal. The nurse thanks him for donating. He smiles, leaves the hospital, and continues living his life. A few days later, his phone rings. Hello, this is the blood donation center. Your blood test showed something we'd like to discuss with you. Could you please come back today? He isn't worried. He assumes they simply need another signature or maybe another sample. But when he arrives, the doctor gently looks at him and says, "Your hepatitis B test is positive." Everything around him suddenly feels quiet. His smile disappears. His heart begins to race. How? I don't even feel sick. Is this a mistake? Will my family get infected? Can I still get married? Will I die? Thousands of people hear those same words every single day. And many ask those same questions because hepatitis B often gives no warning. It quietly infects the liver, sometimes for years before symptoms arrive. That is why it has become one of the world's most misunderstood infections. But today we are changing that. Today we are going inside the human body to uncover the science, the myths, the hope, and the truth about hepatitis B. Welcome everyone. Welcome back to my channel. I am Dr. Aminat, and this is your trusted home for evidence-based medical education, where we simplify medicine and empower healthier lives. If you are new here, welcome. Every week we take complicated medical topics and explain them using real patient stories, beautiful medical animations, and evidence-based science that anyone can understand. If you enjoy learning about health, please subscribe, turn on the notification, and join thousands of people who believe that knowledge saves life. Today's topic affects nearly 300 million people worldwide living with chronic hepatitis B infection, yet millions don't even know they have it. By the end of today's video, you will understand what hepatitis B really is, how it attacks the liver, how it spreads, how it doesn't spread, acute versus chronic infection, symptoms, testing, treatment, vaccination, pregnancy, prevention, and the biggest myths surrounding hepatitis B. Now let's begin our journey inside the liver. Before we understand the disease, we first need to understand the organ it attacks. Your liver, most people never think about it, yet it is one of the hardest working organs inside the human body. Every minute your liver is working for you. It filters harmful substance from your blood, stores energy for later use, produces protein that help your body blood clot, makes bile to digest fast, stores vitamins and minerals, helps fight infection, supports your immune system, and performs hundreds of life-saving functions every single day. Now imagine a virus silently entering this incredible organ. That virus is called hepatitis B virus, or simply HBV. The word hepatitis means inflammation of the liver. There are several viruses that can cause hepatitis, including hepatitis A, hepatitis B, hepatitis C, D, and E. But today our focus is hepatitis B because unlike many infections, hepatitis B can hide quietly inside the body. Many people have absolutely no symptoms, no pain, no fever, no warning, and yet the virus may already be affecting their liver. That's why hepatitis B is often discovered unexpectedly during pregnancy screening, employment medical examination, routine health checks, or blood donations, just like the young man we met at the beginning of this story. So how does the hepatitis B attack the liver? Now let's shrink ourselves down and travel inside the human body. Imagine millions of healthy liver cells working together like a busy city. Every cell has an important job. Together, they keep your body alive. Now imagine the hepatitis B virus entering the bloodstream, and the virus travels through your blood vessels until it reaches the liver. Here, it attaches to the liver cells, enters them, and begins making copies of itself. Soon, one virus becomes 100, then thousands, then millions. But there's something fascinating. The virus itself isn't responsible for most of the liver damage. Instead, your own immune system recognizes infected liver cells and launches attack. Its goal is to remove infected cells and stop the virus from spreading, but unfortunately, this battle causes inflammation. If the infection continues for many years, repeated inflammation can slowly replace healthy liver tissues with scar tissues. This process is called cirrhosis. As more scars develop, the liver becomes less able to perform its essential functions. In some people, long-term infection can also increase the risk of liver cancer. This is why early diagnosis is so important, because then hepatitis B is identified early. Healthcare professionals can monitor the liver and recommend the most appropriate treatment and follow-up. So now let's talk about how hepatitis B spreads. Okay, how does it spread? Hepatitis B spreads when blood or certain body fluids from a person with the virus enter the body of someone who is not infected and not protected by vaccination. So common ways could be mother to baby during childbirth, through sexual contact, by sharing needles or syringes, through unsafe tattooing or piercing with contaminated equipment, and through accidental needle sticks injuries in healthcare settings. In many countries today, donating blood is carefully screened, greatly reducing the risk of transmission through blood transfusion. One important thing to remember is that hepatitis B is much more infectious than many people realize if appropriate precautions are not taken. But that doesn't mean casual everyday contact spreads the virus. In fact, that's one of the biggest myths we are going to correct today. So how does it not spread? You can't get hepatitis B from hugging someone, holding hands, sharing food, sharing drinks, glasses, using the same toilet, sneezing, coughing, sweats, teas, mosquito bites, working together, going to school together, swimming in the same pool. You can't get hepatitis that way. Simply being around somebody who has hepatitis B, that doesn't cause infection. These everyday activities are completely safe, and understanding this fact doesn't just protect your health, it protects people from unnecessary discrimination. Knowledge creates compassion. Fear grows where facts are missing. So whenever someone tells you hepatitis B spreads through casual contact, remember that is a myth. Now let's separate the acute versus chronic hepatitis B. After someone becomes infected with hepatitis B, two different journeys are possible. The first is called acute hepatitis B. This is the initial infection. Many healthy adults are able to clear the virus naturally over several months with the help of their immune system. Once they recover, they usually develop long-lasting immunity against future infections. The second journey is called the chronic hepatitis B. This happens when virus remains in the body for more than 6 months. Instead of disappearing, it stays inside the liver. Some people with chronic hepatitis B may have no symptoms for many years, but during that time, the virus may continue to damage the liver silently. One important fact surprises many people. It's one of the important facts that surprises many people. Adults who become infected are much more likely to clear the virus than newborn babies. So babies infected around the time of birth have a much higher chance of developing a chronic infection. That is why preventing mother-to-child transmission is one of the most important goals in hepatitis B care. Now let's talk about the symptoms. One of the biggest reasons hepatitis B is so dangerous is that many people have no symptoms at all. Others may experience symptoms that are so mild, they may mistake them for a flu. And when the symptoms do occur, they may include extreme tiredness, loss of appetite, nausea, vomiting, pain in the upper right side of the abdomen, fever, joint pain, dark urine, pale stool, and yellowing of the eyes and skin known as jaundice. But remember, many people never experience any of these warning signs, and that is why routine testing is important, because the liver can be damaged long before you ever feel sick. Now let's talk about the diagnosis. How do doctors know whether someone has hepatitis B? The answer begins with a simple blood test. Several blood tests help us understand what's happening. Some tests look for parts of the virus itself. Others look for antibodies made by your immune system. Together, these tests help healthcare professionals determine whether someone has a current infection, a past infection that has resolved, protection from vaccination, or chronic hepatitis B. Doctors may also request liver function tests, ultrasound scans, or additional blood tests to assess how well the liver is working and whether there are signs of liver damage. Sometimes, a special blood test called the HBV DNA test measures how much virus is present in the bloodstream, also known as viral load. All of this information helps guide treatment decisions and long-term monitoring. Now, let's go to the treatment. One of the first questions people ask after diagnosis is, can hepatitis B be cured? The answer depends on the type of infection, because many people with acute hepatitis B recover naturally with supportive medical care. So for chronic hepatitis B, there's currently no medicine that completely eliminates the virus from the body in every person. However, effective antiviral medicines can suppress the virus in many patients. These medicines reduce viral replication, protects the liver, lowers the risk of complication, and improves long-term health. Not everyone with chronic hepatitis B needs medications immediately. Some people require regular monitoring instead. Treatment decisions depend on factors such as viral activity, liver inflammation, liver damage, and overall health. And that is why regular follow-up with a healthcare professional is essential. Now let's talk about hepatitis B and pregnancy. So receiving an hepatitis B diagnosis during pregnancy can feel frightening, but there is encouraging news. With proper medical care, the risk of passing hepatitis B from mother to baby can be greatly reduced. Routine hepatitis B screening during pregnancy helps identify mothers who need additional care. If a pregnant woman has hepatitis B, a healthcare team will determine the best management plan. And after birth, the newborn can receive preventive care, including vaccination and in some cases additional preventive treatment to greatly reduce the chance of infection. The earlier healthcare providers know about the mother's hepatitis B status, the better they can protect both mother and the baby. This is why early prenatal care is so important. Now let's talk about hepatitis B vaccination. If I could choose one word that has saved millions of lives about hepatitis B, it will be vaccination. The hepatitis B vaccine is one of the greatest achievements in preventive medicine. It trains your immune system to recognize the virus before you ever get exposed to it. And if the real virus enters your body, your immune system is already prepared to defend you. In many countries, the hepatitis B vaccine is part of the routine childhood immunization schedule. Adults who are not protected may also be eligible for vaccination depending on their circumstances and local recommendation. Vaccination doesn't just protect individuals, it protects families, future generations, and entire communities. Sometimes, the most powerful treatment is prevention. Now, let's talk about the complication. Okay, what happens if hepatitis B is left untreated? Remember, the liver is one of the few organs in the human body that can continue working even after significant damage has already occurred. That means that many people don't realize something is wrong until the disease has progressed. Over many years, persistent inflammation can slowly replace healthy liver tissues with scar tissues. This process is called cirrhosis. Think of it like replacing a soft sponge with hard concrete. The liver becomes stiff, less flexible, and less able to perform the hundreds of vital functions your body depends on. As cirrhosis worsens, the liver struggles to filter toxins, produce essential proteins, and regulate many important processes. Some people may eventually develop complications such as fluid accumulation in the abdomen, bleeding from enlarged veins in the digestive tract, confusion caused by liver dysfunction or liver failure. Long-term chronic hepatitis B can also increase the risk of liver cancer, even in some people who do not have yet cirrhosis. But here's the important message. These complications are not inevitable. Early diagnosis, regular monitoring, appropriate treatment when indicated, and routine follow-up can significantly reduce this risk. The goal of modern hepatitis B care is not simply to diagnose the disease, it's to protect your liver for the future. Now let's play our favorite game, myths versus facts. 1. Only people who look sick have hepatitis B. That's wrong because many people look and feel completely healthy for years. Another one is hepatitis B spreads through organ or sharing food. That's false because everyday casual activity contacts does not spread hepatitis B. Another myth is if I have no symptoms, I can't have hepatitis B. That is false because many people have no symptoms until liver damage has already begun. Another myth is there is no way to prevent hepatitis B. That is totally wrong because vaccination is one of the safest and most effective way to prevent hepatitis B. Another myth is hepatitis B diagnosis means my life is over. No, that is wrong because many people living with hepatitis B continue to work, raise families, achieve their goals, and live fulfilling lives. Okay, with appropriate medical care and follow-up. Knowledge changes lives, and today you know more than you did 10 minutes ago. If there's one message I want you to remember today, it's this. Hepatitis B is often silent because it doesn't show symptoms, but silence does not mean safety. The good news is that we have powerful tools. We have accurate blood tests. We have effective vaccines. We have treatments that can help many people living with chronic hepatitis B. And we have knowledge. Knowledge allows us to protect ourselves, our families, our future generations. And if you have never been tested for hepatitis B, consider speaking with your healthcare professional about whether testing or vaccination is appropriate for you. If you have already been diagnosed, remember this, your diagnosis does not define who you are. It is simply medical information. With a regular follow-up and appropriate care, many people with hepatitis B live long lives, productive and meaningful lives, okay? Don't let fear stop you from seeking help. Don't let myths replace science, and don't let silence delay action because early detection truly can save lives. So thank you so much for watching, and if you found today's video helpful, please like this video, subscribe to the channel, and share it with someone who may benefit from this information. Every share helps spread knowledge that could protect someone's life. I am Dr. Aminat, and remember, knowledge saves lives, prevention protects future. Stay informed, stay healthy, and I will see you in my next video.